the patient on the day of test. That means how should they appear on the day of test? 3 days before appearing for the test, they need to take adequate carbohydrates in their diet. And the one evening prior to the day of test, suppose if they are doing the test on 26th, on 25th they have to take 30 to 50 grams of carbohydrates on the 25th evening. Then they should avoid any kinds of drugs and they should avoid smoking. And on the previous day of the test, there should be no strenuous exercise. General walking and general works can be done, but there should not be any strenuous exercises. And the night before the day of testing, they should stop eating before 8 p.m. so that as we already know, we are ideally collecting the sample at 8 a.m. and we need the patient to be in perfect fasting. So by 8 p.m. the previous night, they have to stop eating so that 12 hours fasting is maintained. On the day of test, on the morning of the day of the test, there should be no breakfast. They should come at 8 a.m. for the test. 8 p.m. they have stopped eating, and 8 a.m. they will be first sample is collected. So 12-hour fast is maintained and no breakfast is given. And after the glucose load is given at 10 a.m. the second sample will be collected. So between 8 a.m. to 10 a.m. they should not roam around or they should not go to office or do any some work. We should tell them not to go away and they should stay in the hospital and they should just wait. No other physical exercises needs to be done. So these are the guidelines that the doctor has to suggest the patient that they have to follow before the day of test. 3 days before the test, the evening prior to the day of the test, 2 days prior to the test, and the night before the day of test, on the day of test, the morning day of test, and then during the test and after the test. So all these things we have to train the patient.